them that's right. Remember to reiterate and repeat the question and then answer it. This last week we had a tough one, so there's no other way to put it. Our numbers are unrelenting in our hospitalization. We've seen records set in terms of cases, hospitalizations, ICUs, and then unfortunately deaths. Our hospitals and our first responders are doing everything they possibly can. And as we did last week, there's reasons to be optimistic. There's reasons to be optimistic over the horizon with a vaccine. There's reasons to be optimistic now that we have new therapeutics that we're able to use. There's also reasons to be optimistic because the data shows if we change our behaviors and take some of the mitigation efforts, there's a cascading effect that keeps people from being infected, which keeps people out of the hospital, which keeps people out of ICU, which saves lives. That is simple math, and it's I want to be very cognizant of what that asks, especially of our small businesses and hospitality industry, our gyms, our fitness facilities. It was pretty dramatic. Asking folks who have already been through
asking them at a time of holidays where in many cases that's where most of the money is made up is a very, very difficult thing. And because of that, we've been asking and pushing that both the federal government, state government need to do everything we can to help mitigate that. So I'm pleased to say that we worked over the entire weekend with our legislative partners. I want to give a special thank you to the House Majority Leader Winkler, who worked extensively on this, and to my team by Win-Win Meeting, putting together a package of relief for small businesses. It's absolutely critical that we get something
quickly to these businesses.
We get something that makes a material difference to them and bridges the gap until the federal government can do what they need to make a substantial impact on the economics and well-being of Americans by passing, whether it's the HEROES Act or a modified version of the HEROES Act. As I've said many, many times, all 50 governors are unified around this. We know that this needs to happen. But the state of Minnesota is going to take some of these votes. And what I'd like to say is the package that we're going to be putting out tomorrow, that we are prepared, along with cooperation with the legislature, I'm prepared to call them back into special session to pass this package immediately. The sooner the better, the relief will be there. Some of the things that we're
able to do sales tax forgiveness for businesses that sell food and beverages, great state regulatory fees, supporting directly for individual workers.
One-time to businesses provide healthcare workers, shelters, and long-term care facilities. This is the best that Minnesota can do, and it makes financial sense. Create a state tax credit for food donations in the hospitality industry, and elimination of the COVID-19 Minnesota Fund Expiration Date. These are just a few of the things as part of this package, working in conjunction with legislative leaders and, more importantly, working in conjunction with the business community on their suggestions to put this package forward. So I want to just speak to those businesses. We hear you. We thank you for making a public health move by closing your doors. You're protecting people. By closing your doors, you're ensuring that we get our economy back better than we have before. And so for that, as I've said time and time again, you should not have to bear the brunt of the financial impact alone. All Minnesotans share in that. So I think this package will be a great way to do that. Again, I would reiterate to our federal partners, to the outgoing administration, and to the incoming Biden administration, please work together. Please find a compromise in there. Please, if you have to move a package now, with the idea that you will come back and move one later, because COVID is not going to end at the end of the month. We're in an unrelenting spike. And again, it forces us to make decisions. With that being said, we've also got another announcement today, another tool in our toolbox to slow the spread of COVID. What we know is the most dangerous part of this disease is the asymptomatic spread, especially amongst very mobile and social 18 to 35 years old. It's not out of malice, it's not out of not caring, it's simply in many cases out of ignorance of not knowing that you've been exposed or you haven't. You're not sick, you don't feel it, you're trying to take precautions, and all of a sudden you have it and you spread it to someone else who spread it either into a long-term care facility, into a school, or someone ends up in the hospital. And so one of the best ways is for people to know if they've been exposed to COVID-19. Can they, and this is what we've ensured can happen, get a test in a rapid manner to get a rapid result.
They can then be informed to take all of the proper precautions, whether it's quarantining or notifying others.
To be able to break the chain of spread. So what we're doing today,
with the help of a nonprofit foundation, we developed an app called COVID Aware Minnesota. You heard me talk about this a little while back. It's being used by about 20 states now, and what this does is, and I have done it, it is painless, it is free, and it is secure. If you download the dashboard, I have exposure detection on, and what will happen is if I go take a test, and the health department we will then get a code that shows me that I've had it. I'll put it in, and it will then notify everyone who is around me within a 6-feet radius for 15 minutes or more. They've been exposed randomly. There's no data tracking. There's no data collected. There's no data sent to the Minnesota Department of Health, nor to Google, to Apple, to anyone. It is simply a random key generated that Mr. Combs will explain the specifics behind it. Guarantee privacy, give you another tool to know. So you were on the patio and you're eating, and don't think there's any reason to be concerned. You could get a notification. I want to clear Minnesotans. This is an opt-in alternative. You don't have to put the code in your phone, and you don't have to notify others that are around you. I would
strongly encourage you, please do so. It's random. People deserve to know if they've been exposed to COVID-19, and then they have a responsibility to make the proper move then. Get yourself tested, you're positive quarantine, and then we can notify others. This is not contact tracing. This is not in and of itself going to stop the spread. It's another
valuable tool that helps us do that.
And I'd just
like to say, the work that's being done by nonprofits, the work that's being done
by businesses, the work that's being done inside state government to ensure that folks have the capacity to be able to understand what's happening to them is critically important. So I would like to
Commissioner Combs from the Department of Information Technology explain a little more about this.
This is that interchange between those two. We're able to use technology to fight against what we know now is a relatively predictable virus in terms of how it's spreading from one another. It's just how difficult it is because of the asymptomatic spread to let people know. And I would like to make note to Minnesotans. You've seen commissioners up, you've seen Commissioner Malcolm a lot, you see Commissioner Grove and others, and Director Ehrman been up here. Commissioner Combs
runs all the state's IT services. And during the pandemic, a pretty amazing thing happened last week. Closed the chapter on our vehicle services with MinLars and launched Min Drive. And for some of you from
Minnesota, this is for about 3 years running. Commissioner Combs did that. While we simultaneously, over the last year, moved and migrated an entire lottery system while it was live to another system that had never been done in the country. We've updated systems ranging from workman's comp to our high schools
and the Department of Education computers. All of those things are being done in a creative manner, working with the Blue Ribbon Commission on Technology, working together with public, private, nonprofit universities, and Commissioner Combs' expertise to bring energy together to make sure that Minnesota's IT systems, Minnesota's upgrades from legacy systems work.
And I would also note he's just been the most sincere and safest election in American history. And here in Minnesota, along with the work of Secretary of State's office and Secretary Simon, Commissioner Combs was one of the people for the last 2 years that was working to ensure that happens. So with that, I would turn it over to Minnesota Minute Commissioner Combs to talk about COVID Aware. Thank you, Governor. Good afternoon.
Good afternoon, Minnesotans.
My name is
Tim Combs, and I'm the Commissioner of Minnesota IT Services and the Chief Information Officer for the state of Minnesota.
Slowing the spread of
COVID-19 is a community effort. It requires the commitment of all Minnesotans to do our best to keep each other safe.
Notifying friends, neighbors, or people we may not know of a potential exposure to COVID-19 is essential to slowing the spread of this virus. Doing that is often very difficult. Today, Minnesotans have a new tool, COVID Aware MN, which is a data privacy-centered COVID exposure notification app
that will help us do just that.
This
adds another important tool to communities that allows us to bring our mobile phones to the fight against COVID-19. The more people that use it, better it works.
Before we get into how this mobile app works, I want to make a few things perfectly clear moving on comments that the government has made. The Apple-Google partnership creates this exposure notification capability was created with data privacy as its foundation. The app itself is completely 100% opt-in. You can decide to adopt the app, you can decide to share a learning with others. You can also decide to share how big of an opportunity it is for others to use this app. The app itself does not track your location or use GPS in any way. It doesn't transfer any information to the state or to anyone else related to location. It does not use your identity or share your identity with others, including with Google or with Apple or with the state of Minnesota. If you install the app at no point in time, it doesn't ask you for any identifying information. It never accesses personal information on your phone, such as your contact information. And it doesn't require you to provide any additional information. So let's talk a little bit about how this app works. The app is completely opt-in. It's a free download available in the Google or Apple mobile app stores. When people opt into the app, their phones generate a random number that changes frequently and periodically to protect the identity of people using the application. The two phones are within 6 feet for 15 minutes. The phones exchange these numbers via Bluetooth. When someone tests positive, they have the choice, and it's really important to underscore that they have the choice of using the app to warn others. Health authorities provide a code that is entered into the app. People that have been in close contact and within the infectious period will then receive a notification that they may have had a potential exposure. If you receive this notification, at no point in time does it tell you who triggered the notification. It doesn't tell you where the exposure potentially occurred. And it actually doesn't even tell you the precise time of the exposure. It just gives it broad time range within the last 3 days, within the last 4 to 6 days. And again, available for download for free from the Google and Apple Play Store. At the core of this was a groundbreaking partnership between Google and Apple. As you can imagine, Google and Apple have not partnered on many things. But in the onset of this pandemic, Google and Apple partnered with the knowledge that a data privacy-centric framework that would allow people to bring their phones to this fight against COVID-19 was essential. We partnered together with the Department of Health, amazing technologists at Minnesota IT Services, and our nonprofit partner, the PathCheck Foundation, who has developed and launching this app in other jurisdictions as well to create this wonderful opportunity, really a groundbreaking set of partnerships. But that partnership has to extend beyond this. That partnership has to extend into communities that look into the potential that this application can provide in fighting COVID-19 and adopt. Businesses with an ability to warn employees potentially, schools, colleges, universities, where the adoption of mobile technology is very rapid with an ability to notify people that we don't know that should be notified, religious spaces. I was at my barber not too long ago and had a conversation with my barber about the potential of using an app like this. It was really clear as we exchanged a conversation that if I could trust my barber to cut my hair, he probably would be an excellent person to vet and validate that this is a useful tool for Minnesota. It is that community collaboration that will be essential for this. I want to encourage all Minnesotans, our visitors, and anyone that spends time in the state to download COVID Aware MN, to tell your communities to do the same. The premise here is simple, yet impactful. If communities are willing to adopt the app, use it to report positive test results, and follow health recommendations when notified of an exposure, this app can help us return to many of the activities we've missed so much and save lives. I'm a father of very active kids, ones who miss playing basketball, who miss going to school, and everything else that this pandemic has taken away from us. Along with other measures, such as wearing masks, social distancing, and testing, we decide to adopt this app as communities, it will help us protect each other and put us on a path forward. Every little bit that we can do to put an end to this virus is so important. The exposure notification technology and COVID Aware MN provides our state with a powerful opportunity to take action, and does so in a way that protects your privacy and information through the whole process. Please visit covidawaremn.com
to learn more. I'd like to transition now to Chris Erzin on the current situation in Minnesota, and we'll also provide some information on what happens if you receive an exposure notification. Thank you.
Commissioner Thomas? I too have downloaded the app on my phone, and I just want to say that if I can do it, you for sure can do it. If you don't believe me, talk to my kids, and they'll tell you that that's a miracle. So anyhow, I'd like to give you an update on what we're seeing at the global level in terms of COVID-19. Our global total as of this morning was 58.7 million cases. 7 million cases, 500,000 cases from yesterday, and 1.39 million deaths worldwide, an increase of 7,354 deaths. In the United States, we're at 12.2 million cases and over 256,000 deaths. Minnesota added another 6,353 cases today for a new total of 276,500 cases. In addition, we added 6,265 cases Saturday and 7,219 cases on Sunday, so another weekend with alarming numbers. And the current pace, we will reach 300,000 cases this week, over Thanksgiving. And we could see 100,000 cases in 15 days. We hope that some of the recent dial-back measures will help delay these milestones. Sadly, today's update includes another 24 deaths. When you add that to the total of 90 deaths reported over the weekend, we have a new total of 3,205 COVID-19 deaths in Minnesota since the start of the pandemic. 8 of these deaths occurred in residents of long-term care facilities. There were 9 deaths in the metro area, 6 in the central counties, 5 in the southwest, 3 in the northeast, and 1 in west central Minnesota. And our total includes 6 people in their 90s, 7 in their 80s, 5 in their 70s, 3 in their 60s, and 3 in their 50s. There's been a total of 106 patients hospitalized and 3,480 receive intensive care. And right now, we have 1,778 people currently in Minnesota hospitals with COVID-19. And of those, 364 are in an intensive care. And we keep this total of 6,353 cases come from a volume of 57,015 lab tests. And our secondary testing positivity is 15.2%. That's up from 7.7 last week, but it's 0.2 of a point lower than we've seen in the last 2 days. I just want to share some context for today's news about the COVID over Minnesota. We're really pleased to have this as part of our response efforts because it will supplement our contact tracing efforts. We have to rely on a person remembering who they may have been in contact with and the places that they visited while they were infectious. And oftentimes that's difficult, and sometimes people have been in a situation in which they can't remember or they don't know the people that may have been in close proximity to them. So you can inform people they don't know but may have been in close contact with potential exposure. The more people use the app, as Mr. Thomas said, the more people can be notified that they may have been exposed. If people have been exposed, stay home and avoid contact with other people, they can't spread the disease. And so this is really important as we work to slow down the spread of COVID in Minnesota and to get ourselves back on track. Additionally, as the governor said, some people feel sick and they can still spread disease to others. So this is you being able to make notifications. And just explain what would happen
if you did happen to have this
app on your phone and then test positive. The state or local public health officials would contact you directly to confirm your positive test report. And if you've downloaded and enabled this app on your phone, then we can provide you with a test result verification code. So the code is not tied to your identity, and no one will know who you are. People who may have been exposed to you.
And this can only happen
after we validated the test results and provided the verification code. So there's no opportunity for, someone thinking this might be a practical help. It has to go through the test results, and we do provide the code and the safety checks in the process. And if you happen to receive, you've got this on your phone now, and you receive the notification that you've been exposed. The notification includes links to our health department site, and it includes some guidance from us on what you should do. So it will say you've been in contact with someone who has tested positive for COVID, and you need to stay home for 14 days. That's the quarantine period. We encourage you to get tested. Even if you have negative test results, however, you still need to stay in quarantine. And the reason for that, as we've talked about, is that the incubation period is 14 days. And so if you happen to test negative on day 5, that you still have the rest of the incubation period potentially become positive and infectious. But as you heard, the app will give you a range of time when you may have been exposed to help you with your decision making and quarantine. If you have symptoms, we want you to get tested for COVID, and you can also talk to your healthcare provider if you want more information. If you don't have symptoms and you got that notification, again, we want you to stay home for 14 days, stay out of circulation, so that you aren't a potential source of infection and transmission to other people. And some guidance about when you should be tested. Usually we say about 5 to 7 days after exposure, just because that's a more likely time that someone would have become positive, and so the test will be meaningful. But the will give you guidelines when the exposure likely happen, and you can also take
But we're really excited about what this
could mean, particularly in this time when we're seeing so much transmission. This app will really help us enhance our outreach efforts in terms of our public health response. Thank you, and I'll turn it back to the governor.
Thank you, Director Erzman. Minnesotans.
Thank you, Director Erzman. Minnesotans, as I said, it's been a challenging week, and we're in the most difficult time of this pandemic. We're also in the most hopeful time of this pandemic. We have both therapeutics for treatment. We have vaccines on the horizon. The news from AstraZeneca, Oxford today gives us another one. Soon you'll be hearing news from Johnson & Johnson and others that opportunity is there. Those are all things coupled with the app.
If we dig down, we do the things that make a difference.
We dig down, we do the things that make a difference. Mask up, socially distance, follow the mitigation rules. Download this app. If you need to get tested, quarantine, and let's break the spread of this as we move forward. I spent extensive time this morning with our team on briefing on vaccine rollout. I will lead this briefing and beyond with Secretary Azars from Health and Human Services, who will be updating the nation's governors on where we're at on vaccine rollout and development. Just so that folks know what's looking this time of the year.
We'll be going through all this, and once everything was done and they were approved, then they can start figuring out the manufacturing process. It ain't gonna be done simultaneously. Most corners are done. Safety is a top priority. Minnesota will verify that.
Be a top priority. Minnesota will verify that, but the opportunity is really great. But here's what we can't do. We can't let our guard down. We can't put people at risk when we know there's things we can do to make a difference. So I would hope right now, if you're listening or you're thinking about it, you've gone on to the Apple or the Google Play Store and you download that, It is literally less than 30 seconds to get yourself up and running. And here's the thing, if everything's done right, you will never have to use this. You will never be notified, and you will never have to notify anybody else. But if it does happen, this is your opportunity to be a good citizen and pass it on. Again, I want to just tell you, the conversations, and I spent a lot of time in the United States Congress on this issue of privacy in a technology-driven world, that is a top priority along with the healthcare benefits. You heard Commissioner Combs talk about this. I can assure you that we have done, and outside groups and privacy groups have run the traps on this thing. Your identity is protected, your location is protected, your anonymity is protected. But here's the thing, it also can protect your health. So with that, I'll take some questions from our pooled reporters.
I'll let Commissioner Combs, and I'll take responsibility.
I'll let Commissioner Combs, and I'll take responsibility on this. Commissioner Combs was very early adapter on a lot of this. We've been very aware of this technology early on. I think one of my concerns was making sure that we had run the traps on the security and the privacy piece of this. And once again, I think getting a little bit of field testing on this and getting it out there amongst people really matters, because if people choose to believe, or if they get caught in, a conspiracy theory black hole on the internet, they don't do the adaption. So it was trying to find that proper balance. Commissioner, you may talk, because we've had this conversation for a month.
Thank you. I certainly don't think it's
Thank
too
you.
little.
I certainly don't think it's too little, too late. This pandemic has certainly proven to be incredibly unpredictable, and this is another tool made available to Minnesota communities that communities can use alongside with masking, social distancing, and there's a long ways to go, and every tool that allows us to resume activity in our communities, whether it's in social spaces or economic spaces, really is important. It's a tool that can help protect employees in settings, a tool that can help protect families in settings, and reaching out to people that may need to be warned isn't possible because you simply don't know who they are. And so absolutely, I don't think it's too little, too late, as the governor mentioned. We, from the onset of this pandemic, have really scoured the globe related to opportunities and technology can play to assist. How can we use innovative technology to help everyone? And from the onset, certainly the data privacy aspect was unbelievably important to us, and we really spent a lot of time watching the rollout, looking at the rollout, while we were continuing to work in these spaces to make sure that we rolled out an app that could really brought broad consideration to the data privacy concerns. It's a great question. It was really an amazing partnership. So Google and Apple partnered on the exposure notification framework that is broadly in use across the globe now. And it has with the past foundation physicians from the Mayo Clinic, epidemiologists,
feedback to Google as it relates to infectious periods and alter how that exposure notification
framework work. The actual app development work was done by the Check Foundation, and they're launching a similar app in other jurisdictions as well. It's a nonprofit organization.
I'll start with your first question, and that is, so I go in and I get tested and I test positive. The way that our current law is that communicable diseases are reportable to the department. So we do get the names of people who test positive for COVID. That's how we're reaching out and doing our case investigation. So when we reach out, call an individual. So if I got called by the health department, they would go through the interview and say, Chris, have you downloaded this app? And would you be willing to use it? And if I say, yes, I have, and I would like to be able to notify my potential exposures, then they will give me a code. And without that code, I can't notify people. And the goal then is that the health department has the ability to control only when we verify the really positive test with the notification that goes out.
Yeah, other states have used it and found it useful.
Commissioner Holmes can talk about some of the studies too.
So in all places.
So in all places, the efficacy of a tool like this really goes broadly alongside other measures, masking, social distancing, testing. It's been rolled out.
Various responses that countries that have adopted an app-based approach, which is really all of Europe and a number of states in the United States. The app certainly plays a large role.
The app certainly plays a large role in the suppression of
research from Oxford University.
According to research from Oxford University, for example, as little as 15% adoption in a community setting. And I think it's important to remember that the adoption is within community setting. Essentially,
adoption sometimes is viewed as
a holistic state level. If a college or university, for example, has 15% adoption, they may see a slow of COVID-19 just by the ability to notify them. Keep in mind, it's bookended by choices that we make. Our willingness to warn our neighbors, friends, or people that we don't know, and then our willingness to follow the recommendations and take the necessary safety precautions so that we don't spread it to someone else.
That is an excellent question, and that is exactly what we're doing. You'll see, probably social context from those settings as they are promoting it within their settings. We've had conversations with a number of universities that are very eager to promote this within their student bodies, but also other community settings, whether it's workplace settings or whether it's religious settings in other places. And one of the things that's really important is that critical trust component, that ability to support and promote this. Really can't be that you launch an app and then you just kind of forget. You have to continue to educate people. You have to find that barber, right? You have to find Nathan the barber.
Right, you have to find Nathan the barber.
Share it with every person that sits in his
chair because he's within 6 feet
every
of
single
people,
day.
15 minutes every single day. Now, he has greater context to that, but our universities and colleges, absolutely what we're doing.
Getting back to this Oxford study, that if you have a population that we see people who are resistant to some of the other advice, they be resistant to doing it. So small level of participation, any level of participation makes a difference.
Absolutely, even a small level, and as we share, broadly, the more people that adopt, the greater the benefit is, and I think that benefit already starts at like 10 or 15% adoption. And so, certainly it is in all of our collective best interest if we trust this, if we look into the data privacy,
if we
feel that wow, it doesn't ask my identity,
it doesn't ask my identity, it doesn't track my location.
We share that with our
really easy to install, and we share that with our friends and neighbors as a mechanism, and we can collectively
we already have 10 or 15% adoption along the way. Everyone that brings home to this fight against COVID-19, in addition to that, really can provide a powerful opportunity to continue to suppress the spread.
Do you have any predictions or hopes here to what level you can get to this? What percentage? Any realistic predictions?
No predictions. I could share that in a most recent launch, Colorado had 1 million people download the app within the first 2 weeks. And I certainly think that in Minnesota we're very different and have high hopes and aspirations that we'll do our due diligence, that we'll visit the site, that we'll look into the framework, that we'll look into the data privacy. And so no predictions, just using that as a backdrop. But what we know is when it's not a broad community joint effort, that the potential of something like this certainly won't meet what it potentially can. So that, you know, collective joint community aspect and engagement is going to be really important. Absolutely. That's why the community aspect of this, even as it relates to
this, even as it relates to the potential, is really, really important. The community in their setting can decide that this is a tool to have, along with social distancing, quarantine, masking, that they can use in those settings to protect themselves.
So the website says this is contact tracing, but last week Commissioner Malcolm had said that our contact tracers are on the way to well, they're out right now, and our cases can this lockdown to replace the need for contact tracing, given that our contractors are lockdown.
Yes, actually, that's a really good question. And as we're seeing these unprecedented numbers of cases, our workload has increased exponentially along with the case growth. And so we are looking at ways that we can be effective in our outreach, as well as think about how to best utilize our resources. So we're grateful for this as a tool, and we'll continue to look at, you know, how do we manage all the things that need to happen in light of
the
so it hasn't replaced contact tracing.
So it hasn't replaced contact tracing at this point. It's an important tool, but we're certainly evaluating manage our resources with the high number of cases that we're seeing.
Oh, absolutely. Right, this uses Bluetooth technology, and so it does have the ability to make that differentiation. The one thing that we've talked about that it doesn't differentiate if there's a barrier as is right here.
Barrier
That's one thing that
right here.
you know it won't do, but it does have the ability to differentiate distance because of that Bluetooth.
I asked about the discussion of the special session. You're talking about you already have a deal done. You have agreements with lawmakers in place.
There's no deal done yet, but I think the way these things work is that we have put together a package and specifically, which
in the House specifically, which a spending bill originates there, and put together basically, I started to see where the appetite was. I've said over the last few days that it appears to be very bipartisan. The desire to get help to small businesses was strong, and I think what we did is just work the lead on this, put this out in the way this will work. There'll be compromises together. I feel very optimistic that this would be one where I think we could find a good compromise. I think it's where we could work together around the pandemic in a very productive way. And I think this is just the first step in it. So, well, again, you saw some of what we're going to put out there tomorrow. And the way the system works, then there, of course, is some of the
I just have a sense of urgency around the lack of federal response on this. Minnesota can do something, and
Minnesota could do something, and we targeted things that were both very short-term, immediate triage, and that were longer.
Just licensing fees, your sales tax, some of that. All of a sudden, there's
sales tax, some of that. All of a sudden, there's money freed up into these businesses in the short run.
Well, those are things that we will put that out.
Those are things that we will put that out. But those are things that we're looking at. I would note to everyone that the budget forecast is scheduled for next week. That's the time it's in there. I would hope and think that there will be some projections.
Minnesota, we're going to know where we're at on revenues, where we're at on the budget, what we're looking at going into the next biennium when we start this next session in January of 21. But that should give us a good place that we should be able to work some of this out, be ready to come take a look at those numbers, put this package together, and get that help to folks right now. No, not specifically yet. And I think it was important for us that we were looking at what we could do, both from an administration standpoint, and then talking with folks in the House where it would have to originate. I'm getting giving every indication that there's a desire to get something done. I'm trying to leave that space for the legislature to partner in this. I keep hearing that they want to be part of this decision making. So I'm going to put this out there. I'm going to put our package out there, and I think their job is, it's like this normally works, start to come into that discussion.
I would certainly encourage, I'm feeling the same from these businesses and from employees, the pure sense of immediacy right now. And I'm looking at it to make like the difference. And if there's a capacity, that's why I think the timing of us coming up against some of our budget numbers, our forecast numbers, our revenue numbers worked out really well. That I think we can sooner rather than later. But once again,
the legislative branch will be the one that will.
The legislative branch will be the one that will start to move some of that. I think there's a capacity here for us to truly partner together in a really small, targeted way. Do through
But if not, I would say Minnesotans, you got this opportunity. I'm going to guess in state government, I'm going to encourage state government employees to download this app. I noticed we had folks from the governor's office in this room and Department of Revenue. I'm going to guess and hope that they were downloading as we were speaking this app, some of you in this room. And I'd ask Minnesotans to do this. Again, your privacy protected, it's an opt-in. This is a really good way to just be neighborly and say, hey, by the way,
my ability and then Minnesotans, because I do not believe the vast majority of Minnesotans are not just willfully not pretending that this is real. They simply don't know they've been exposed. They're simply trying to go about their daily life. And I think now with hospital bed space at a premium, our healthcare providers are literally telling us they will get down on their knees to slow this. You got a real tool for wearing a mask to social distancing, and now putting this on your phone, and then the nearly stopping town. You have the capacity to control with our behavior. This should help you do that. So I would encourage everyone to wear MS on your app stores.
And as I said, my hope is that you never have to use it, you never get a notification. But if you do, you do the neighborly Minnesota thing, and you pass on that anonymous note so that others can make an informed decision for themselves and their families and our workers. And again, I would just preview, we'll hopefully be back tomorrow with a fleshed out package of relief for our small businesses and their employees who are simply doing what's right to protect their neighbors. And I would ask us both as a legislature and Minnesotans, let's put together a Minnesota package. Let's inspire the federal government to do what they need to be doing, put together a nationwide package, do the exact same thing. Get ourselves here into the first part of next year when you come online, and let's get through this thing. And let's get back to things we love, let's get back to things that make a difference in our lives. Thank you all. Commissioner Director.
Commissioner Director.
You've been watching Governor Tim Walz and others.
You've been watching Governor
new technologies to track COVID-19.
Minnesota unveiled a new